In this section, we're talking about X-linked A-gamma globulinemia. This is an immune deficiency syndrome related to B cells. It's also known as Bruton's A-gamma globulinemia. This is an X-linked syndrome, as the name suggests, and it is due to the failure of B cell precursors to become B cells. So in this condition, patients are unable to produce light chains, and this is due to the defect in the Bruton tyrosine kinase, or the BTK gene. So if you don't have light chains, what this means is that you basically don't have receptors on the B cells and you cannot make antibodies. Symptoms usually begin at about 6 months of age, and this is because this is about the time that the child loses maternal antibodies. So people who suffer from immune deficiency syndromes suffer from recurrent respiratory bacterial infections. This is because of the loss of opsonization of antibodies. So recurrent infections from H. influenza, Streptococcus pneumonia are extremely common. A classic presentation would be recurrent otitis media, as well as sinusitis and even pneumonia. Additionally, these individuals also have gastrointestinal infections. This is because of the loss of IgA, which makes the patient more susceptible to enteroviruses and even parasites such as Giardia, simply because there is no IgA to block the entry of these organisms. The key findings include the absence of mature B cells in the peripheral blood, which are usually marked by CD19 and CD20. There will also be underdeveloped germinal centers of lymph nodes and absence of all classes of antibodies. Treatment is usually done by the administration of IVIG, which is intravenous immunoglobulins that are pooled immunoglobulins that are missing in these patients being administered directly to them. The next immune deficiency syndrome is selective IgA deficiency. People with selective IgA deficiency have defective IgA B cells. Now, the exact mechanism is still unknown, but the main problem is that there is a deficiency in the Ig antibodies. Most patients are usually asymptomatic, and they are unaware that they have selective IgA deficiency at all. However, when some patients are symptomatic, they present with recurrent sinus pulmonary infections, otitis media, sinusitis, and pneumonia, as well as recurrent diarrheal illnesses from giardiasis. Now, this is all due to the deficiency of IgA, which is vital in the mucosa and in protecting the body against these pathogens. In selective IgA deficiency, there is a risk of anaphylaxis with people receiving blood transfusions. This is because the blood products that they are receiving contain IgA. However, due to the lack of IgA in the body, they produce antibodies against IgA. SLE, which is systemic lupus erythematosus, and rheumatoid arthritis, are very common in patients with selective IgA deficiency. However, the exact mechanism is still not known. Diagnosis is usually done with serum IgA levels, which is usually marked by less than 7 milligrams per deciliter, and a normal IgG and IgM ratio. When talking about the treatment, asymptomatic patients require no treatment. Prophylactic antibiotics may be given. And in some cases, IVIG is administered. This contains little or no IgA and usually only contains IgG and IgM. The idea behind this is to administer a lot of IgG and IgM so that they take care of the infections since they're in such big quantities. An interesting feature is that many women with selective IgA deficiency have a false positive beta-HCG pregnancy test. The IgA deficiency there are heterophile antibodies produced, which cause the false beta-HCG. Up to 30% of IgA deficiency patients test positive for beta-HCG. Moving on to the next deficiency, which is common variable immunodeficiency, also known as CVID. This is actually a collection of many disorders with variable degrees of immunodeficiencies. There is a defect in B cell maturation. So this causes for the loss of plasma cells and antibodies. And this can be due to many underlying genetic causes. However, most of them go by being unknown. There are more than 10 genetic mutations that are associated with CVID, and often there is no family history. So let's talk about some of the features. So this is associated with a normal T cell count, with the absence of antibodies, which is usually IgG. However, sometimes IgA and IgM may also be deficient. Someone with CVID can present with recurrent respiratory bacterial infections and GI infections, such as enteroviruses and giardiasis. However, the onset is usually later on, between the ages of 20 and 45 years of age. However, there is an increase in frequency of other diseases, such as rheumatoid arthritis, pernicious anemia, and lymphoma.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.